Hi, I'm Alicia Michelle, and as a trained and certified Christian mindset coach, I've helped hundreds of Christian women discover brain science-based mindset tools to help them grow closer to God and break free from anxiety, perfectionism, people-pleasing, and feeling like they're never enough. The Christian Mindset Coach is the award-winning podcast that shows you how to use simple brain science principles and biblical truth to renew your mind for lasting confidence, joy, and peace. I'm so glad you're here. Grab a cozy spot and let's get started.
Hello there. Welcome to today's episode of the Christian Mindset Coach with me, Alicia Michelle. If there's one question that I'm asked a lot about, at least for the women that I'm friends with in real life and the women that I coach that are in the same season of life that I'm at, it is all about hormones and perimenopause. What in the world is going on with our bodies? Why are these things happening? And how does it affect our emotions? If you've been wondering some of these things, you are going to love today's episode. I have on today Dr. Mikala Albertson, who is an author of a new book called Everything I Wish I Could Tell You About Midlife. And I love that she shares, as a doctor, a family practitioner, what is really happening in our bodies, but also she's speaking as a woman who is just beginning this journey herself and has worked with clients for almost 20 years going through this and just wants us to feel seen and heard in some of the things that we're experiencing. I am excited to talk to her about these things because I know that this phase of life dramatically affects how we feel, how we show up. And as we're talking about emotional confidence, yes, there are things like we talk about the ADD method and we talk about emotional prep, all the things that are covered in the book, Emotional Confidence. But there is a chapter in there that pertains to this kind of a topic. And that is, how do we take care of all the other parts of ourselves? Because all of those other parts can affect our emotions. And especially during this life season, when it's not just our hormones that are changing and our bodies that are changing, but we have changing life circumstances with parenting, with marriage. There's so much being affected. Maybe some of us are going back to work for the first time in a long time. Some of us are changing careers completely. Mikala shares her experience today about how she's switched things up in her own career. So it is just a really kind of a wild time. And all of that can dramatically affect how we feel and allows us to have a little bit more grace for ourselves when there are those days when we feel up and down and a little bit out of sorts. This conversation, my prayer is that it will equip you, it will empower you with some knowledge about science, but it will also, like she has shared, make you feel seen in some of these areas and give you some practical things that you can do to address what's going on. We have a lot of conversation here about how do I talk to my doctor about XYZ so that you don't feel maybe as helpless and unseen in this season. Because a lot of us, if we're not careful, can fall into that. And that can just further exacerbate our ability to feel like we're able to manage what we're feeling well. Here is more information today about our guest, Dr. Mikala Albertson. She's a board certified family practice doctor and well-being advocate who's passionate about women's health and healing in the middle of our messy, ordinary lives. She is the author of Ordinary on Purpose, along with this brand new book, Everything I Wish I Could Tell You About Midlife. And she inspires readers to aim for wholehearted living through a gentle, achievable, sustainable approach. She and her husband have 5 children and live near Salt Lake City, Utah. And you can learn more about her at MikalaAlbertsonND.com. Here is that conversation with Mikala. Mikala, thank you so much for coming on the show today. I appreciate you being here with us and answering some of these kind of difficult questions that we don't normally talk about, but I'm so glad that you're here.
Yeah, thank you so much for having me. It's my privilege.
Yes. So first, we're talking about midlife, of course, but why do you think so many of us are surprised by these issues, like the hormonal changes, the shifts in our body? I mean, we kind of expect ourselves to grow older, but why is it so particularly shocking to us in this culture right now, it feels like, to go through midlife?
Yeah, I think there's a couple of answers to that. I think we are maybe the first ones, our age group are kind of the first ones to be a little bit more open and to have a few more questions. And we maybe grew up with parents who didn't share a lot of that. I know I didn't get a lot of information from my mom. I got just little snippets here and there. But I feel like just the generation above us were a lot more private about what they were willing to share. And now I'm like an oversharer. So I think that's part of it. I do think there's been a lack of research and science in women's health up to this point. For a long time, it was, well, women are just smaller men. And so a lot of our research was around men, and women's health in particular kind of had a little bit of a back burner. And I think that is shifting as well. Means we're a little bit behind. And so I know that can be frustrating for us who are right in the middle of midlife right now. We want answers now. But sometimes the science just hasn't caught up yet, and we don't have the answers yet. And then lastly, I think we are just so influenced by marketing and beauty and wellness culture. And I think what we're told is we're just supposed to be like fabulous at 40 and just fit and active and not aging at all.
Right.
And so when we don't really feel that way, it's like, oh, am I doing something wrong? Something wrong with me? So yeah, I think it's a collision of all those things.
You're right. And I think that there's not a lot of models for it, for moving through this stage in a healthy way. We see people kind of doing the extreme of trying to do everything in their power to look a certain way. And we are like, oh, I don't want to go that route. But then you're like, I don't know if I just want to let it all go either, you know?
Right.
And is it normal to just have these things happening in my body? So I feel like it's good that we're having these conversations, like you said, because this hasn't really been an open forum or things to talk about up until now. So yeah, it's
Right.
good. It's good to have them in light of some of the other pressures that we're feeling. And even when we feel things like just normal situations that happen in this stage, like empty nest syndrome or dealing with these changing career roles or changing parenting roles, marriage challenges. So how do you see those things also kind of compounding some of the issues that we face during midlife?
Yeah, I think that's really difficult to tease out sometimes. I think it would be nice if we could compartmentalize things and be like, okay, this is for sure hormones, or this is for sure something going on in my body. And then the other stuff is its own separate thing, but it's really not. And all of those things are intertwined. And so I think that also the frustrating part for women in this life stage is it's really difficult to tell if some of our symptoms are from stress and anxiety, and are we not sleeping because we're worried about our 19-year-old now who's at college and we're not sure what he's doing, or is it perimenopause? And so sometimes we don't find the answer to that exactly. We can't really say, oh, this is for sure that, because they contribute to each other and they kind of build on each other. Which is why in this book, I kind of wanted to address all of those things. I think it's something that maybe I felt a little bit limited by in the clinic when you only have 15 to 30-minute office visits. Like, let's talk about your body. But knowing full well that there are things in day-to-day life that are having huge effects on those symptoms and on just general well-being for women in midlife.
No, I agree. I think a lot of times you as a clinician have limited time where you can go into those things. And you're right, there's so many factors at play here. It is hard to tease it out. And the hormones might affect how we're viewing our marriage at that point, or the fear we're feeling, the anxiety that we're feeling. And so in light of that, do you think that we should treat them all kind of together, or how do we address them if they're kind of this big ball of stuff going on at once?
I think you kind of have to treat them all together, right? And it really, I think it helps to kind of take one symptom at a time. Like, let's say, oh, if sleep is a big issue, let's kind of look at sleep. And certainly all of those things that we talked about could be contributors, but how do we address it? How can we set ourselves up for good rest at night? What does good sleep hygiene look like? Maybe do we have to be taking a sleep aid for a short time? Sometimes regardless of what the underlying cause is, because it could be more than one thing. I know I always like to know, like, well, why is this happening? What is the root cause? And sometimes it's not just one thing. And so in midlife, we have to take a little bit of a symptomatic approach at times.
Yeah, that's helpful. And I think a big part of it too is just recognizing and acknowledging that even if we're not quite sure what the root is, that there's a lot of factors at play here. And it's very plausible to feel the way we're feeling, that it's not
Yeah.
something wrong with us. We're not broken, that all the things that we want to think that we're the only ones, but that even if we don't have the luxury to say it's because of this,
Yeah.
that there's a lot of things happening and we can give ourselves grace to get through it.
Yeah. And really not be afraid to try something for relief. Like, there are certainly some options, I think, for any of the symptoms that come up that can offer some relief. And it may not be forever. You may get through that season, and maybe anxiety was a huge contributor just from some social stressor, and then things can change down the road.
Yeah.
So I think that can offer a lot of peace for someone to think, okay, I'm going to take this for a short time. We can reevaluate later, and it may not be forever.
hmm Right. That does help. That does help with the stress side of it. Like, this isn't my future. And I want to come back to that question because I think that was one of the questions that someone had shared with me, was this fear of that it'll always be this
Mhm.
way. But before we get into that and some of the other questions that were shared with me, I would love to hear your story. What's it been like for you to walk this journey?
Yeah. So I just turned 45 this summer. So I feel like I have a lot of midlife yet to go. I decided to write this book kind of from the middle of it because I have been talking to women for 18 years now in clinic. And I have a lot of just other people's stories. And I know that I've been hearing a lot of the same concerns and issues from women, for these nearly 2 decades that I've been in practice. And now here I am, and I'm experiencing some of it myself. And so I'm still kind of early, I think, into some perimenopausal symptoms, but I'm definitely having some of the other midlife transition things to go through as well. My kids are, and my oldest is 19 and my youngest is 8. So we have kids in a lot of different life stages and life events. We sent a child off to college, and now he's living back at home this semester commuting. And so we kind of did the year without him. And now we're like, oh, you live here again? We're kind of having to
Yeah.
figure that out. And
Yeah.
now that's a strange thing, to live with a child who's kind of been used to doing his own thing and having his own timeline and his own curfew. And how do you navigate that as a parent? And I have a marriage that's over 20 years old as well. And I've been through some big career transitions also. So I was out in clinic for 18 years, and then it's almost 2 years ago that I quit that clinic job, and I've been writing full time. And in that time, putting together this book. And so just trying to figure out who I am, which has
Yeah.
been a big surprise for me because I really thought at 45 I would have some of those things nailed down. And
Exactly.
so I think
Yeah.
that's been like, oh, I guess you never really quite figure that out, or the next thing comes along and then you have to figure that out. So it's been fun to do that, and also like a little unsettling sometimes. Yeah.
Yeah. No, you bring up a great point in that there are a lot of things that are changing, and that affects how we can show up differently. When we're going through those young years with our kids, there's a lot of boundaries on what we can do because of
Mhm.
maybe we're devoting this time to our family and helping them. And suddenly there are different options. Or maybe we, like you said, we have been working in a career all this time and we want something different. It's just time to transition out. So it's almost like there's this shaky ground that's happening.
Yeah.
And
Yeah.
it really, I think for a lot of us, it feels like we need to lean deeper into our faith, and that these changes are going to be happening. These shifts are going to be happening. But who are we in Christ?
Yeah.
Has that been coming up for you as well? Just that
Yeah.
side of it?
I think I lived the first half of my life feeling like I was on the right track because other people would tell me I was on the right track, or I got a lot of validation and affirmation, like, wow, oh yeah, good for you. It was just like I was
Mm.
always doing what I was supposed to be doing, if that
Yeah.
makes sense.
Yeah.
And then just in the last few years, it's like, hey, what do I want to be doing with this second half of life, and what feels
Yeah.
good? And I have struggled a little bit there because I have had the response from people like, what? Really? Like, what are you doing? And I haven't quite had that same, affirmation, but it feels a little more right internally. And I think that must be the spiritual part. And so that has been encouraging in a different way. I wish that that would always be enough for me, but sometimes that's tricky. And so I am still a work in progress there.
Paris. And yeah, no, we are, aren't we all? But I think it's an opportunity that God gives us to just really dig into that and decide, who do you say I am? And begin
Yeah.
to live through that. Because there's some things about us that will never change. And even though our life is changing and we can cling to those in seasons like these, at least that's been my experience and it's keeping me more grounded through some of this. And speaking of being grounded, I wanted to ask you some of these questions that people had shared with me that they
Sure.
wanted me to ask. Some of them friends of mine, some of them just listeners to the show. One of them was about this fear that we feel. And we kind of touched on it a second ago. She said, well, she described the fear, saying that it's a loss of control of who we were and a wondering of who we will become. So her exact words were, there's so many fears around all the changes. You aren't the person you were yesterday. How do you deal with the fear of, is this going to be forever? And how will these changes affect my marriage? How will this affect who I am? Can I overcome this and come out better on the other side? I don't know how to fix myself. I can't fix myself. So
Mhm.
like all of us, just uncertainty. We knew how to do these other things. And it's like
Yeah.
suddenly again, everything is, especially the stuff that's like you said, like you talked about, like not sleeping. You can take this for a little while, just transitional stuff. But how do you get over some of the mental side of the fear behind it?
Yeah. I think that resonates a lot with me. I think now that I'm just entering having older children, that's come up for me a lot. I think as a younger mom, I had a lot more control over just life in general and what life looked like at our house and what we were eating and who was going where and at what time. I just really, I was the person who was orchestrating all of those things and setting the schedules and doing the things. And now that I have older kids, I've become a little bit more of a peripheral person, and several of my kids just kind of go by their own schedule. They're driving, they're, doing their own thing. And it feels a little bit like a loss of control. And the question of, who am I if I am not their mom? And who am I if I am not the orchestrator of these things? And I can sort of feel that changing. And then it makes you think about all the other things, your marriage and your career and all of these things. And I know that that can feel really fearful. And I still am trying to make that transition myself into understanding that I actually don't change much.
Mm.
Like the person who I am on the inside and the values I have and just the things I love and the interests I have and what fills me up doesn't change a whole lot. And it's been fun to have a little bit more time for those things and be able to put them a little bit higher priority. And I wonder if that's just a shift that we need to make during this time. I'm going to come out the other side even more fully me, I think, which is actually pretty cool. It feels a little bit scary, but it's actually pretty cool. I don't know if we come out better necessarily. I wrote in there, right in the introduction, just kind of the story with my editor when I first started putting this book together. And it was like, well, I was kind of talking about how women feel weary in midlife sometimes. And my editor was like, I don't think we should use the word weary. We want to write something, promising women that the best of life is yet to come. And so I kind of write about that story and how I just felt like, I don't know if I can say that.
Yeah, it's hard to
I think there's a lot of peace probably
Sure.
coming and a lot of letting go. And I think all of our life is letting go. And I think just becoming more rooted in who we are and who we are in God.
Yeah.
But I don't know if like we come out better as far as like the world's point of
Mm.
view, And so I do think it's a mindset shift that I'm still working on myself. But I hope that lends some answer to her question there. It is scary, and I think it's okay to feel that. But I keep sort of turning inward, I think, as I come up with all of those concerns and trying to be really true to who I am so that I come out the other side, whatever that is, maybe as an empty nester or maybe, whatever that means exactly, just feeling really just grounded in myself.
Yeah.
I think
a lot of that question, because I know this person well, I think a lot of her question was about changes in life, but also about the changes in our body. Like,
Yeah.
I think that's the scary thing, especially if
Mhm.
we've been in generally good health up to this
Mhm.
point where we're like, why is this happening? Like, for example, me right now, I found out this week I have a frozen shoulder and I've been struggling with this
Oh,
for like 10 weeks. And I'm like, finally got the MRI to diagnose it. And they're like, yeah, it's hormones. And I'm like,
yeah.
dang it. But why did
Yeah.
this happen? Like I've always been somebody who's liked to do yoga and Pilates and all this stuff. And I'm like, what the heck? Like now I am this crippled, aching, hurting person who has to take pain meds and do all this
No.
physical therapy. And it's like, wait, like,
Yeah.
so
I do think it's
yeah.
good to know that, gosh, that perimenopause time is long, actually, 4 to 10 years before menopause, which is a really long time. So
Mm,
that part is frustrating. But
yeah.
studies do show that we do come out another side, and we may not, it's not like we're going to emerge in our 25-year-old body.
Yeah.
We do kind of emerge in a body that's not going through the roller coaster.
Okay. That's encouraging.
And I think the roller coaster is what causes most of the symptoms. It's the up and down and the
Okay.
unpredictability. And it's the sometimes I'm having ovulatory cycles and sometimes I'm not. And then
Yeah.
my body is just kind of a little bit haywire.
Yeah.
Studies do show that there is another side. So that brain
Okay.
fog stuff
Yeah.
actually tends to get better when we're postmenopausal. And, I think we settle into different sleep patterns. So
Okay.
most older people don't actually require as much sleep as they did when they were younger. And so there is another side to that. I do
Yeah.
think there are some adjustments that we have to
Yeah.
make and like an acceptance of, okay, my muscle mass is different than it used to be.
Yes.
It's not going to be like it was when I was 30.
Yeah.
But as far as kind of the ups and downs, it does level out.
Okay. That is encouraging to hear because I
Yeah.
think for those of us who are in this stage, and just to clarify, maybe to give us some context, when would you say we can say officially, okay, I'm in perimenopause? And when can we
Mhm.
say, okay, I'm officially out of this and officially
Mhm.
in menopause and have moved forward?
Sure. So perimenopause just means that time around menopause.
Yeah.
And the actual definition of menopause is the final period, which we can't really make that diagnosis until 12 months after that final period. So once you've gone 12 months without a period, you can officially say, I'm menopausal.
Okay.
Perimenopause does include that first year after menopause. So it still is that time around. And we don't have like a hormone level that we look at necessarily that says, yep, you're in. Nope, you're not. So we do have to kind of base it on symptoms. So if
Okay.
you are still having periods sometimes and you're having some symptoms along with it, then you are in perimenopause. So we
Yeah.
don't really follow hormone levels necessarily.
Yeah.
And I think when you're menopausal, so as soon as you do have that last period and you're 12 months out from that, it's not like the symptoms just shut off immediately. So really, for as long as you're still having some symptoms, you can, still be, you would be called menopausal, I guess, instead of
Okay.
perimenopausal. But, you would certainly meet criteria for maybe benefiting from menopausal hormone therapy or sort of treating symptoms with that.
Hey, it's Alicia. If you have a hard time managing or even feeling your emotions, you are not alone. How do we know what we're feeling, especially when our emotions are so overwhelming and confusing? And what do we do with those feelings, especially as Christians who want to follow Jesus? If you're ready for more peace and calm in your emotions and to get off the crazy emotional roller coaster, you will love the practical strategies that I share in my new book, Emotional Confidence: 3 Simple Steps to Manage Emotions with Science and Scripture. You'll learn the 3-step process that I have taught to tens of thousands of women to partner with God to manage emotions. You'll learn how to handle emotional overwhelm, overthinking, and avoidance, to acknowledge feelings without judgment, to process emotions through God's clarifying lens of truth, and to courageously choose a scriptural response. Yes, you can honor your feelings without compromising biblical truth. Let me show you how to use both science and scripture together to become someone who handles her emotions with confidence. Learn more at aliciamichelle.com/emotional-confidence.
Okay. Just again to clarify before we get into some of the therapies, because that was another question. What are some other symptoms besides your periods changing?
And so we think of the periods changing as kind of the hallmark symptom. That makes
Yeah.
it really easy to call it
Yeah.
perimenopause, right? But that doesn't always happen right away. So sometimes women will look back once they begin skipping a period here and there, and they'll be like, "Oh, I think I've been having symptoms for years," because they're having things like changes in sleep we talked about,
Yeah.
so trouble falling asleep, but often that early morning waking, like, "Oh, I'm just up at 3 in the morning or 4th morning. Why is that?" But that's pretty common. Yeah. Yeah, that brain fog that we talk about. And
Yeah.
sometimes it's like trouble with word finding, or I just like, wait, why did I walk in here again?
Yeah. Yeah.
Or you just kind of don't feel quite with it. So it's like that fluctuates a little bit
Okay.
throughout. So that might not be every day, but some
Yeah.
days. Hot flashes are a big one.
Yes.
Sometimes those are during the night. So night sweat, which can just contribute to that sleep issue, right?
Mhm.
We also think about vaginal changes. So when estrogen is decreasing in our body, it can change the mucosa, the
Okay.
mucosal linings. And so we see a little bit of thinning there. And so that can cause vaginal dryness or irritation and sometimes more frequent urinary tract infections because of that mucosal change. Joint issues like you're experiencing, frozen shoulder is actually quite common. The good news is that kind of goes away too. Like you work on it and do some physical therapy, but that should improve over time. So that's good news. This won't be forever. What did I miss? Did I miss anything?
I don't know.
Just about hits every organ system.
Yeah.
Which sometimes feels like, what is happening in my body? Because
Yes.
it's a lot of things.
And because we haven't lived the other side of it, we think I'm always going to have these crazy changes happening. But like you said,
Yeah.
the menopause side, a lot of it starts to level out again, and it's not quite so.
Yeah, because it's not the highs and lows. It's not the
Yeah.
ups and downs. You kind of reach this,
Okay.
more steady state.
Okay. Okay. So let's talk about hormones. So how do we know if we have a hormonal imbalance? How do we get our hormones checked? And this is really the key question, as my friend described it. How do we get general practitioners to do more than just normal blood work and believe us when we feel the way we do? They seem to always come up with reasons other than doing more testing on hormones. So what does that look like to have that conversation? What do we ask for?
Yeah.
Walk us through that.
Yeah. Oh, that's a big question. So I maybe have a lot to say about that. I don't know. So I think it's a good idea when you're 40-ish and you're starting to maybe notice some changes to just establish care with someone, find a
Yeah.
primary care provider, see them a few times, plan to see them a few times because it does take a little bit of time to tease out sometimes exactly what's going on. And a lot of medicine is trial and error. Also know that we know it's frustrating. And it can feel frustrating for us too. I can tell sometimes when someone's like, you're not telling me what I want to hear. And, like I want you to do something. And
We
I
want
want
you
you
to fix
kind of,
us. Like, why
I would
can't?
like you to fix us.
Yeah,
And
yeah, that's frustrating
I
too.
want more than anything to fix it
Yeah.
also. And sometimes it's just not an easy thing to do. So I know that it feels frustrating when we do blood work and it comes back and we say, well, everything checked out pretty normal. But that shouldn't feel like we're telling you that nothing is wrong. My hope when I say that is that it should feel like reassurance.
Okay.
So your blood levels are okay. You're not anemic. Your thyroid's checking out okay. It's not that you have hypothyroidism and we need to replace your thyroid. Look at your kidney and liver functions are great. So that means all your electrolytes are looking good. You're keeping up on calcium and vitamin D. It's not a vitamin D deficiency. So some of that initial blood work is like, let's rule out all of the other things before we settle in on perimenopause, because perimenopause is a diagnosis of exclusion. All those other things need different treatments.
Sure.
So we want to make sure we're not missing something there. So that initial blood work is important to do that. And it should feel reassuring when it's normal. Not that there's nothing wrong or you're crazy or
Right.
you're not experiencing symptoms, but now let's settle in on perimenopause and what should we do?
What is that then? Because I feel like that's where the conversation often ends with a
Yeah.
group of doctors is they're like, well, you're not also okay. And
Good
you're
luck.
like, but how do we get them to, how do we get
Yeah.
a doctor? I don't want to say them, 'cause that sounds derogatory, but how do we communicate hey, how do we
So
check
now what?
other things?
Yeah.
Yeah, the now what?
Yeah. So now what? I will say that this may be something that's like hard to hear. And some people
Yep.
may not like to hear it, but we don't typically check hormone level to help us decide how to treat you in perimenopause. So you don't need to have an estrogen level of this and a progesterone level of this and a testosterone of this and all of these things to say, yep, you need to have a replacement. Because remember that our levels are going up and down and up and down. And so if we checked you one day and we get these numbers, we could check 5 days later and have totally different numbers.
Yeah.
So sometimes checking hormone levels only adds to the confusion a little bit.
Okay.
And I do see that talked about a little bit on social media. And that is
Yeah.
sometimes a little bit frustrating for me as a provider
Sure.
to see.
Yeah.
Because it feels a little bit like people are getting taken advantage of. Like, got to have your hormone levels checked, and then you're going to come every 2 weeks and we're going to check them. We're going to make sure that you're on the right path. And you don't actually need that. So you can start on hormone replacement therapy. We like to call it menopausal hormone therapy because we're not replacing you to a pre-menopausal level. We're just replacing enough to help with your symptoms.
Okay.
You can start on that without having any levels checked. I think the next question would be, all my blood work turned out okay. I'm still having these symptoms.
Yeah.
I feel like it's perimenopause, and I would like to treat those symptoms
Okay.
either with hormones or some other medication. And then
Okay.
depending on what your main symptoms are, then you kind of hone in on what that might be.
Okay.
If you can take hormones, that's a great place to start. So if you don't
Yeah.
have any contraindications, that's a great place to start. And you actually don't need to follow levels. And sometimes I feel like those places that you can go outside of maybe, your insurance doesn't cover it, and you can go to
Yeah.
these like hormone clinics. People are not going to be happy with me saying that. Sometimes I feel like those are predatory.
Sure.
They are money makers,
Absolutely. Yeah.
and you don't need it.
Yeah.
You can get that help
Yeah.
covered by insurance with your
Right.
primary provider. But you may have to actually say those words out loud, or
Yeah.
you may have to find a provider who feels comfortable prescribing hormones. I
Right.
love that there are actual menopause clinics now that are covered by insurance. So people who really specialize just in that. So I think as we're having more conversation, it will become a little bit more easy to
Okay.
follow.
So then you're just saying do the regular blood work tests. If everything
Yeah.
comes out normal, then to begin to ask the doctor not, hey, you need to put me on hormones, not telling them, but
Yeah.
saying, I feel like I'm seeing these other symptoms. How do I know if something like a hormone replacement would be good for me, or what other things can we try to help alleviate some of what I'm
Yeah.
feeling?
I think that's
Okay.
exactly what you said. So if you feel like,
Okay.
oh, they said it was normal, like come back just whenever, I
Yeah.
think then that's when you advocate and say, I'm still having these, I'm
Yeah.
having this, and this.
Yeah.
And you could take my book in and say,
Sure.
here's a whole chapter in perimenopause. Look at this list of symptoms. I'm
Yeah.
having 6 or 8 of those.
Right.
So could we talk about hormone replacement or menopausal hormone therapy? And if you're early in the menopausal transition, sometimes that could be a birth control pill, which is pretty easy
Sure.
and inexpensive. But what we hope to do early in the menopausal transition is kind of suppress your ovulation. So you're not getting huge swings in your hormones, that we can kind of take them over with the birth control pill and just give you a
Yeah.
level amount.
Okay.
Later in the menopausal transition, when you're starting to miss periods, that's when we would prescribe estrogen and progesterone separately. It's actually a lower dose at
Okay.
that stage if you're already not necessarily having ovulatory cycles.
Okay.
So it kind of depends on your age and symptoms, what works best for you.
Yeah.
And if you're having primarily only vaginal symptoms, you could start with just topical vaginal estrogen. If you're having only hot flashes, and that's the main thing, like if you could get rid of that issue, there are medications that are non-hormonal that can just work on hot flashes.
Okay.
So that's where you just say, what are my options here? I got to take
Yeah.
something. I don't want to
Yeah.
suffer through this.
Yeah.
What will it be? It may take you advocating for yourself a little bit.
Yeah.
And it's okay to switch providers and kind
Yeah.
of find the person that you jive the best with.
Right. And is that generally a general practitioner, or should we go to an obstetrician gynecologist?
I think either one. I
Either
think
one.
your general practitioner is a great place to start. I
Okay.
know that some family practitioners, like once they've done the initial workup and they feel like, I don't feel super confident in prescribing hormones, or they might be better served by an OBGYN. So you may start there and then get referred. So that may go a few different ways.
Okay. Okay. Good to know. I
Yeah.
appreciate that. I mean, I think there has to be that balance for us as patients to be able to know enough to be able to advocate, but also to have a relationship with a doctor that we trust enough to say,
Yeah.
I trust that if I ask you this, that you're going to help.
Yeah.
And you're not, and we don't, not every doctor is that way, but I appreciate there's doctors like you who are like, yes, let's look at some of these other things. And so that we don't have to feel like we are going to some of these other places where we're just taking
Yeah.
it over. We're just going to do it no matter what, because some doctor doesn't know, sometimes there's those dialogues. So,
Yeah. I think so
that there's an
too.
in between that's healthier for
Hmm.
everybody and both sides. Okay. So we talked about that. Let's talk about another hot topic, and that is libido.
Yeah.
So another listener was asking, how can we restore and maintain libido as the body changes during perimenopause and after? And so I would ask that question from both a female perspective and a male perspective, because I would guess that men are also going through changes during this time period. So how does
Sure.
that work in a marriage in terms of the libido?
Yeah. Here again, I think it's a little bit different for everybody, right? I think we have also like the cultural standards kind of come into play again. And so we're like, is everyone else having sex 3 times a week?
Yeah,
Like, is that
exactly.
what we should be shooting for? Is that what's normal? And if I'm
Right.
not
Yeah.
doing that, then there's something wrong with me and we need to get it back going again. Or, I think really sitting down with your partner and talking with them about, hey, are you happy with the sex that we're having? Should we be doing something different there? And if they're happy and you're happy and it's actually like a couple times a month, like that's great. You don't have to like meet some standard to be having normal sex and libido. Does that make sense? So
Absolutely.
I think this is a conversation you have with your partner together. And I do think that again changes. So
Sure.
what maybe was normal for the two of you when you were in your 20s is probably going to be different in your 50s and 60s.
Yeah.
But I think the idea of, are we happy with that? Are we satisfied with that? Is how are things between the two of us? And do we want
Yeah.
something different? That's the conversation to have first, I think.
Okay.
I have go ahead.
No, I was going to say, so is the expectation then that there is less libido for both men and women in this season? That's kind of the typical pattern, or?
I think that's a little bit of a typical pattern.
Okay.
I don't know that I can speak to everyone there,
Yeah, of course.
right? But I think
Yeah.
that is a more typical pattern.
Okay.
And I think that could be multifactorial
Sure.
because not only could it be hormones and perimenopause and maybe levels of testosterone, but the fact that you have like 3 teenagers and a tween living in your house
Yes.
and like they're not home yet, or they don't get home till midnight, or they came in and something happened. I mean, there's like a billion reasons that you can kind of get derailed.
Yes, for sure.
Right. And so, it's figuring out, is this a libido problem
Mm.
or is this like a life problem? This is like normal in the face of what's going on right now, I
Yeah.
think is important as well.
Okay. No, that's
Yeah.
good advice there.
Yeah.
And then the
And
last one was muscle and strength building. It's important, but is it too late once you're in that peri or post menopause?
it is not too late. If I could tell anybody, if there's anybody in their 30s listening, like please start strength training now. So we do know that our muscle mass decreases over time and we begin to lose muscle mass in our 30s and then it just kind of continues. So we have to kind of actively combat that loss through strength training. And you can do that in a number of ways. You can do that with dumbbells, you can do that with yoga and just like your body weight stuff. You can do it with resistance bands. But we do have to actively do something to prevent kind of that continued loss.
Okay.
And we know that maintaining that mass just pays huge dividends in the end with mobility and falls and our joint health and just general activity. And the more muscle mass we have, that affects kind of our overall weight and body composition as well. So how we're burning calories and using the food that we take in, so important. And then along with that is bone health as well. So that resistance training is actually huge for just maintaining your bone health and preventing you from losing bone mass down the road too, and maybe becoming osteoporotic and having fractures.
Awesome.
The weight training, if I could have, you know, I feel like that's as important. We've always heard like aerobic exercise, you got to be getting, I think weight training is equally as important. So if you could do that 3-4 times a week, that would be huge for you down the road.
All right. So in light of all of this, what is some kind of, just to close the conversation, general encouragement for us in this season that you hope women walk away with after reading this book, or just even in our conversation today?
Yeah. I feel like we could have talked for a very long time, right? There's so many things we didn't even touch on in the book. Anyway, like there should be a whole talk on sex. And anyway, but I think I wrote this book for a few reasons. I know how frustrating it is sometimes to see your provider and to feel unseen or unheard or misunderstood. And I know that we're like inundated with just information on health, and some of it's contradictory. And so it's a little bit like, I actually don't know who to believe.
Right.
I know that that is just a frustrating part of midlife. And so I'm really hoping that this book, when women read it, will feel seen and understood. So it's full of stories. Some of them are my own stories. Some of them are patient stories or friend stories. So each chapter begins with, I hope, what is a relatable story that you'll be like, oh yeah, like the details might be a little bit different, but you'll be able to see yourself in those stories. And then the second half of each chapter is hopefully pretty easily digestible kind of background information, kind of just the general science that I hope that you could know about the thyroid or ADHD or mood disorders or hormones. And so when we have that knowledge, we'll feel empowered. I want women to feel really seen and understood and then empowered so that you can go to your provider and say, hey, here's what I know about this, or this, and what are we going to do about it? We got to work on this together. You should feel in control of your medical decision making, and it might look a little bit different than your friends, and that's okay. But I want you, women who read it, to feel really empowered to make those decisions for themselves. And then I'm hoping that that will just give a lot of peace. Like, we're not just flailing around out here trying to figure out midlife. It's like, oh, I'm not crazy. You know, I'm not the only one going through this. There are some things that I can do. And so now I'm going to go do it. And then how peaceful, you know, maybe we could take that part off the plate of like the teens and marriages and other transitions that we're going through, right?
Yes, definitely. No, I appreciate all of that. I think that's very important for us to be able to be seen in this process, but also to have the knowledge. Because in order to advocate, you do have to know that you're not crazy. You have to have some knowledge. But like we've brought up several times, like we want knowledge, but we want to still work with the doctors and other people who are trained in this in our lives. We want to be able to partner with them because, but there's sometimes isn't that being seen. So I appreciate that your book is for people to feel seen.
There's a lot of information out there.
Yeah.
And so I'm hoping that this is like, these are the current medical guidelines right now.
Right.
For what we know about women's health right now in 2024.
Yeah.
Because sometimes it gets really cloudy. Like, what is information? What is misinformation? How do we make sense of that? And so I just wanted to have a place that women could come and look and kind of cut through the noise a little bit and then take to their provider and work together with them.
Awesome. Well, tell us more about where we can get connected with you. I know you can find your book on Amazon and all of the other places, but if women wanted to reach out to you and had questions or just more about what you're doing, where could we go?
So I'm on Facebook and Instagram as Mikala Albertson, MD. My website is MikalaAlbertsonMD.com. I've got some general resources there that are free, and I add a lot of blog posts and just further reading that women can do there. I also have an Instagram page that's pretty fun and a little bit new. I just started it called Be Well-ish. And it really is just medical information. So I don't
Yeah.
share any personal stuff or longer writing or anything there. It's
Yeah.
just kind of general women's health stuff, which has been kind of fun as well too.
Yeah,
So
great. Well, thank you
yeah.
so much for these words today. We appreciate all of it. Thank you for being here.
Yeah, thanks so much. I really enjoyed talking with you.
Thank you. Wow. I hope that that was a time of you allowing yourself to see all of the things that we're facing if you're in this season right now, like I am, of perimenopause, and figuring out what is the new normal in light of all of the changing hormones and situations happening in our lives and in our bodies. I hope that you felt that maybe there are things that you didn't even realize that could have been an issue that are the reason why you may be feeling a certain way. I just hope you feel seen and heard through all of that. And from an emotional perspective, I wanted to talk about what some of the things that we can do to help ourselves through this. We want to look at the medicine side, the physiological side, a lot of the things that she was addressing. But I think a lot of acceptance is huge in this stage, and a lot of acknowledgement. The 3-step process that I teach in emotional confidence is acknowledge, discern, and decide. And in certain phases of emotional processing, sometimes we want to lean more into one aspect of that processing through ADD. And I would guess that the acknowledgement is actually the one that would be the strongest here, because it's so easy. It's so easy to get lost in when you're having a day where you just have no idea why you're feeling like this, where you feel like almost like your body is betraying you, where, like she was saying, you walk into a room and you're like, I have no idea why I came in here, or I have no idea why I just feel so out of control emotionally the last 3 weeks or something. It's really helpful. It's really helpful for us to start first by just seeing, why does it make sense? Why does it make sense that I'm feeling out of control right now? What are some things that are happening that make it plausible to respond like this? And then, of course, balancing it with the second step, which is to discern. And that is to say, it's true that, it's true that I'm feeling these things, or it's true that this is a really challenging season for our family. But it's not true that some of the things that she shared today can really help in this area. Like, it's not true that the up and downs that I'm feeling aren't an indication that I'm going crazy, or that I have something wrong with me, or there's something wrong with my identity. It's true that I can stand strong in who I am as someone who loves Jesus, as someone who is known by God. And it's true that this won't last forever. I think that was something pretty comforting for me to hear as she was talking through that. Moving to that last stage of decide, knowing what I'm feeling, acknowledging that and seeing it, knowing what the truth is. What is the next best step for me to take here? What would God want me to do? And where can I emotionally dwell throughout this? Taking that perspective of, yes, this is the reality of kind of how my body's reacting, or how my kids are reacting, or how our marriage is changing and shifting. And yet, this is the next step that God wants me to take. And this is where I'm going to choose to allow my thoughts to dwell and to live, versus noticing, or maybe I would say allowing myself to notice when things kind of go off the rails. I'm so that I can keep them in this specific space of, God is with me. God is going to get me through this. This is not forever. There is hope. There are things I can do to help myself through this season. I'm not going to live in this time of despair. I can choose to believe that God is with me. So I just would encourage you, in light of everything that she talked about today, first, get her book. It's a great book. It has that medical information like what we were sharing about today, but it also has the stories and the experiences behind it. So you feel like this is somebody who gets it. This is somebody who is feeling what I'm feeling. And that's really important. And there are some very good practical next steps that she gives in that book too. So get her book. Again, it is called Everything I Wish I Could Tell You About Midlife. And her name again is Mikala Albertson. It's Mikala and then Albertson, Albertson. And of course, you can find that on her site, which is MikalaAlbertsonMD.com, or you can find it wherever books are sold. So check that out. And if you want more support with managing emotions through this season, my book, Emotional Confidence, is out very soon. By the time we're releasing this, it'll be out in a couple of weeks. But if you're listening to this later, then it will be available. Either way, you can either pre-order it or order it at Amazon. It's Emotional Confidence, 3 Simple Steps to Manage Emotions with Science and Scripture. And Mikala and I were talking when we finished our interview about how I really see how these 2 books could be a good match together, working together through seeing the science side of it, through what she was sharing and the stories, and also here are some practical ways to manage the emotional side of it as it's coming up. Friend, thank you so much for being here. Thank you for being a listener. If this podcast has been encouraging to you in any way, would you take a second and leave a review, leave any kind of comments about things maybe that have been encouraging or inspiring? Share it with a friend. This is one of the best things you can do to help this podcast grow. And it lets the algorithm know that this is a good podcast to show to more people. And I just love hearing the stories of how people connect with me and with each other, honestly, other women who are in my communities and coaching programs and things because of the podcast. So if this podcast is encouraging to you, please share about it. Please leave a review and a rating. We would appreciate it. All right, friend, take care. I'll see you at our next episode next week. Bye-bye.
Thanks for joining me today for the Christian Mindset Coach. If you loved today's show, would you take 2 seconds and share a 5-star rating and review on Apple Podcasts? I've got a special gift for you when you share a review, my amazing 50 I Am declarations, 50 statements and Bible verses about who you are in Christ. This is an audio meditation and a written statement that is extremely popular with my clients, and I want to give you access just for sharing your Apple Podcast review. Simply screenshot your review and send it to hello@vibrantchristianliving.com, and we'll send you the link to access the 50 I Am Declarations resource. Thanks so much for sharing your rating and review so that we can get the word out about the podcast. See you back here next week.